Dr. Andrew Hamill here to talk a little bit about poliomyelitis, or more commonly known as polio. Polio is a virus that affects the central nervous system and the spine. Polio enters through the mouth and can be transmitted orally or from fecal matter to one's mouth. It replicates in the throat and the gastrointestinal tract. After a week of onset, there will be less of the virus in the throat, but it would still be present in the feces. It invades the local lymphoid tissues, enters the bloodstream, and then may affect cells of the central nervous system. The initial symptoms of polio are fever, headache, fatigue, vomiting, stiffness in the neck, and pain in the limbs. Unfortunately, there is no cure for polio, only prevention. Repeated vaccinations can allow prevention from the virus. Polio mainly affects children under the age of 5, with a death rate of 2 to 5% in children, and between 15 and 30% for adults. 1 in 200 victims become paralyzed in the legs. Paralysis or weakness in the muscles still present a year after onset is permanent. One of the most famous survivors of polio was President Franklin Delano Roosevelt, who held office between 1933 and 1945. It was not commonly known he had polio because he was often seen sitting down. There are 3 different types of polio. The most common is spinal polio, which accounted for 79% of cases between the years of 1969 and 1979. Spinal polio causes asymmetrical paralysis, mostly involving the legs. The least common of the 3 is bulbar polio, which accounted for 2% of cases from the decade I previously mentioned. Bulbar polio weakens muscles innervated by cranial nerves. The final type of polio is bulbar spinal polio, which accounted for 19% of cases. Bulbar spinal polio is a combination between both bulbar and spinal polio. Polio was once a disease that occurred throughout the world, but by 1991, polio had been eradicated in the Western Hemisphere with a program directed by the Pan-American Health Organization. Fortunately, by 2009, only 1,579 confirmed cases existed in the world. This is Dr. Andrew Hamill saying goodbye, and thank you for listening to my short talk on polio.